Every week, people come to my consultation who have been wearing glasses or contact lenses for 10, 15, 20 years. And almost every one of them says the same thing at some point. I've been thinking about laser correction for a long time, but I'm scared. The fears are different. Some are afraid of the procedure itself, that it will hurt, that something will go wrong. Some heard from friends that the vision came back afterwards. Some are convinced it's dangerous, that the cornea will be damaged, that there will be consequences 10 years later. I understand these fears. They are real. And today I'll answer them honestly, not to convince you to have the surgery, but so you understand what we're actually talking about. Because a decision like this should be based on information, not rumors. What laser correction is, in simple terms. Nearsightedness, farsightedness, and astigmatism occur because the shape of the cornea, the clear front part of the eye, isn't ideal. Because of this, light rays focus in the wrong place and the image comes out blurry. Laser correction addresses exactly this problem. The laser evaporates microscopic layers of the cornea and gives it a new shape, one where light focuses precisely on the retina. After that, glasses become unnecessary. This isn't magic, it's physics and very precise technology. The laser works with accuracy to fractions of a micron, and modern equipment tracks eye movement in real time, hundreds of times per second. If the eye moves, the beam follows it. If the movement goes beyond set limits, the laser stops automatically. The main methods. What's the difference? There are several methods of laser correction, and this is the source of much confusion. People often use the word laser as a general term without understanding what's behind it. LASIK is the most widely used method. The surgeon creates a thin flap from the surface layer of the cornea, lifts it, the laser treats the inner layers, and the flap is returned to its position. Recovery is fast. Most patients see well the next day. FemtoLASIK differs from classic LASIK in that the flap is created not with a mechanical instrument, but with a femtosecond laser. This is more precise and safer. The result is the same, but the technology is at a higher level. SMILE Pro is a fundamentally different approach. No flap is created at all. The laser creates a thin, lens-shaped piece of tissue inside the cornea, which is then removed through a small opening. The cornea remains virtually untouched on the surface. This is a more modern method with less impact on the surface of the eye. Which method suits a particular person depends on corneal thickness, the degree of correction needed, lifestyle, and other parameters. This is determined individually after diagnostics. The most common fears and what's behind them. Fear 1. It will hurt. The procedure is performed under local anesthesia. Anesthetic drops are applied. No injections, no general anesthesia. During the procedure, the patient feels light pressure, not pain. The laser treatment itself takes seconds. After the surgery, some discomfort and mild burning is possible for a few hours. This is a normal response. By evening, things are generally much better. Fear 2. The vision will come back. The laser changes the shape of the cornea. This is a permanent change. The cornea doesn't return to its original state. But there's a nuance. If a young person's vision hasn't yet stabilized, meaning diopters are still changing year to year, surgery isn't recommended until stabilization occurs. This is why age and the history of vision changes matter. After 40, presbyopia, an age-related change unrelated to the surgery result, can develop. This is a separate process. Fear 3. It's dangerous. There will be complications. Laser correction is one of the most studied surgical procedures in the world. It has been performed since the 1980s, millions of operations. The rate of serious complications is extremely low, but as with any medical procedure, it is not zero. This is exactly why there are indications and contraindications. Not every person is a candidate for the surgery, and that's normal. The purpose of diagnostics is to determine whether a specific patient is suitable. Fearful. They'll refuse me. My myopia is too high. Laser correction is effective across a wide range of values. With very high myopia or a thin cornea, laser may genuinely not be suitable. But that's not the end of the story. There is a method of implanting phakic ICL lenses, which is used precisely in such cases. One method is unavailable, another opens up. Who is not a candidate and why this matters? Laser correction doesn't suit everyone, and this isn't a flaw in the method. It's a sign that patient selection is taken seriously. Contraindications include unstable vision, diopter still changing, too thin a cornea, keratoconus, a condition where the cornea is deformed, certain autoimmune diseases, pregnancy and breastfeeding. Age is a separate question. Surgery is recommended no earlier than 18 to 20 years of age, when the eye has fully formed. After 40, the doctor assesses additional factors related to age-related changes in the lens. This is exactly why pre-correction diagnostics is not a formality. It is a key stage that takes time and includes many parameters: corneal thickness, its topography, visual acuity, refraction, pressure, retinal condition. Only after this can the doctor say which method is suitable, or whether any is suitable at all. What happens before, during, and after. Before surgery, full diagnostics. Contact lenses must be removed in advance. Soft lenses several days before, rigid lenses 2 to 3 weeks before, because lenses change the shape of the cornea and diagnostic results must reflect its natural state. On the day of surgery, anesthetic drops are applied. The patient lies under the laser unit. The surgeon works on each eye in turn. The procedure takes a few minutes. Afterwards, several hours of rest, darkened glasses, prescribed drops. In the first day, don't rub the eyes, avoid bright light. The next day, a follow-up examination. Most patients already see well. Final visual acuity establishes itself over several weeks as stabilization occurs. After surgery, regular checkups in the first months are important. This isn't a sign that something is wrong. It's normal monitoring of the result. Laser correction is a real opportunity to live without glasses and lenses. For most people with suitable indications, it is a safe, predictable, and well-tolerated procedure. But it is a medical intervention, and it should be approached consciously. Not because you read an advertisement or a friend was satisfied, but because you've had diagnostics, received information about your specific case, and made the decision together with a doctor. Fears are understandable. Questions are normal. That's exactly what a consultation is for. If you've been thinking about laser correction for a long time, or simply want to know whether it suits you, start with diagnostics. At Ko'z Nuri Clinic, we conduct a complete preoperative examination. We measure corneal thickness and topography, check all the parameters needed to make a decision. After the examination, you'll know exactly: possible, not possible, or there is an alternative. No pressure, only information. Contact details and booking are in the description below.